I'm Jadis, co-founder and CEO of Motivo Scar Care. Founded Motivo Scar Care through my personal experience transitioning from female to male and receiving a top surgery. Dr. Jonathan Keith actually performed my top surgery. The follow-up care to the top surgery was to wear scar care products and really tend to my scars, which was something that I hadn't learned or experienced with any other previous procedure. Tried multiple different brands and had a negative experience with all of them. And those experiences varied from scar tape falling off to topicals either leaving greasy residue on my skin or drying out my skin. I stopped wearing these products, which ultimately resulted in my scars becoming stretched and keloided. We tried some different interventions to try to help with the scarring and minimize the visibility of it. Ultimately, I had to get a second surgery, a scar revision procedure, and the follow-up care was to wear scar care products. I wanted to take it more seriously that time, but I also didn't want to continue to go in circles and use these products that didn't seem to really be not only not that beneficial for the scar, but for long-term skin health as well. So Dr. Keith and I decided to partner up and form Motivo Scar Care.
Thank you, Rye, and thank you, Jadis, and everyone attending today. I'm Dr. Jonathan Keith, a plastic surgeon, fully focused on gender-affirming surgery at this point in my career. As we mentioned earlier, your scar journey is very individual for everybody.
Something that I've always felt is that scarring is something that creates a dysphoria around someone's image and which goes along with how they internalize their beauty, which is exactly how I felt after my top surgery. Excuse me. So as I mentioned before, Dr. Keith and I met during a surgery consultation. He performed my top surgery and my revision, and that's how I personally became educated on the importance of scar care. So understanding scarring after top surgery. Top surgery is a life-changing procedure, and the healing journey doesn't end when the stitches come out. Scarring is a natural part of the process, but not all scars are the same. As Dr. Keith mentioned before, it's really a unique experience. Understanding how and why they form is the first step to healing better and having better outcomes. So we want to understand that scars are the body's way of repairing after a skin injury, that everybody heals differently, and proactive scar care can significantly improve appearance, texture, and comfort. Some types of scars that can form after surgery can be a flatline scar, most common and typically fade over time. Hypertrophic scars, they're thick, raised, red, or pink. Keloid scarring, firm, and cause a lot of irritation and itchiness in the incision site. And stretching scars. That was the issue that I had with my scars, is that over time they became really stretched because that area of the body is subject to a lot of movement. Genetics play a huge role into how people heal, and healing is very personal. I mean, how you heal and how you scar depends on your skin tone, family history, collagen production, and hormonal changes in your age, and your overall personal health routines as well. So, as I mentioned, this is a personal photo of me after my first top surgery. After I stopped using scar care products, the little white areas are where we tried steroid injections of the scar to help to try to diminish the appearance of it. But I mean, I could have avoided this with the use of scar tape and other interventions. It was something that I personally wasn't educated enough on, so I didn't take it seriously after my first surgery, which resulted in my scar stretching and me having to undergo another procedure.
When I see a patient in consultation and we spend an hour together to talk about surgery and its effects and what things to think about before, during, and after, and how to take care of your scars, a lot of studies show that patients only really retain about 40% of that. And what you heard there, and it's a common thing with a lot of patients, is a lot of self-doubt, self-blame for how something turned out, how it looked. And it's not true. Jadis did a lot to try to take care of his scars. And sometimes it's a combination of things that make it difficult to take care of your scars. And it's not just about education, although Jadis, could have done better possibly. We try to educate. The patients try to educate themselves. There's more resources than ever online than there were, 15, 20 years ago sometimes the body has a hard time. It's a trauma. And the components of healing take a while to really see those effects. And so if you think of the scar journey as those three things, some things you can control. Who do you go to for surgery? Have you looked at what those things are for elective things, obviously, for trauma and for, other types of life events that aren't, at an elective type surgery, you don't have control of that. But things you do have control of, things like this, where you're planning for a surgery, what things you're going to do to take care of your skin and your health and your overall medical status before any surgery, and what are you going to do afterwards? And some things are going to predispose you to an increased chance or likelihood of having a poorer scar or a thicker scar. And so what things can you do to try to prevent that? Jadis mentioned that he started this company, and he did. He brought this idea to me and said, I have this idea. I want this to be a better thing for people, not just me, but I think that people should have better access to better types of solutions. And like I said, we're not here to sell anything or anything like that, but I just want to commend Jadis on his own personal journey of trying to improve access to better types of ideas for scar care, because a lot of what was out there it doesn't work that great. And it's a really congratulate him for taking this seriously and trying to help others. And I love that I could be a part of that, because I am not a business person, and I don't know how to do any kind of business meetings. You can ask Jadis. I'm terrible in those things, but I like to know that the thing that we're working on together is going to help people, because that's why I became a doctor, was to try to help people.